Dr. Sloan, did you see the Senate this week? Dr. Casey Means in front of the Senate for her confirmation hearing. She's not licensed to practice medicine. She never finished her residency, yet she's supposed to be our Surgeon General. Let's throw the clip.
Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
And when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on, different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
Very different.
Very different. Disrespectful of life, birth control. So, let's just start right there. Senator Murray quotes Dr. Casey Means, and she said that people approach birth control like candy and that hormonal contraception has horrifying health risks. Let me say this clearly. Birth control is not like candy. It's one of the most studied medications in modern medical history. And when you compare it to candy or birth control prescriptions like candy or saying that there's horrifying health risks, that is a problem. So I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan, practicing and has a license.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So Dr. Means, her whole comment on oral contraceptives carrying blood clot risks. I mean, that's true. We're not going to disclaim that, but every medication carries risk, right? But in medicine, we also quantify those risks. So according to the ACOG and the CDC's U.S. medical eligibility criteria, also large population studies in the British Medical Journal and Circulation, in health, reproductive age women who are not pregnant and not on hormones, they have different risks. So the annual risk for a blood clot, a deep vein thrombosis, is 1 in 5 out of 10,000 women. So if you combine that with birth control or oral contraceptives, that risk goes up to 3 to 9 out of 10,000 women. And then that's compared to those that are actually pregnant. Those hormones cause higher risk, 10 to 30% in 10,000 women per year. But postpartum, that number gets even higher. That's not an opinion, you guys. That is epidemiology. That's a study. That's evidence. That is peer-reviewed data. But here's what we're missing from this whole conversation. Pregnancy is not just a discussion about blood clots. Come on. This is mortality discussion right now. In the United States, the highest maternal mortality rate is amongst in this country, in the world. That's America. That's crazy that we can't do better. So in 2022, the United States maternal mortality rate was approximately 22 deaths per 100 live births. And for Black women like myself and Dr. Brown, who are wonderful moms, that actually was almost 50 per 100,000. So therefore, Black women are about 2.5 to 3 times more likely to die from pregnancy-related causes compared to white women. So let's repeat that. Black women in the United States are statistically far more dangerous than taking birth control. Many of the states that have restrictive abortion bans also have the highest risk of mortality rates in maternal women. So when we have access to contraceptives, that's been undermined with this administration. When abortion access is restricted, thanks to the Supreme Court, and when maternal health systems are already fragile at best, you're not just reducing risk anymore, you're actually increasing those risks. So when you put that in context, Dr. Brown, that is public health. That's what a Surgeon General talks about.
So yes, Dr. Sloan, does smoking increase a clot risk? Absolutely. Uncontrolled hypertension, does that matter? Yes. Migraines with auras? Absolutely. And that is exactly why birth control is prescribed by licensed physicians. We assess the patient's age, their body mass index, their smoking status, their blood pressure, their family history, their clotting risk. And then we take all of that information and we stratify. We individualize your treatment. We practice medicine. That's clinical judgment. That's not prescribing birth control like candy, okay? And when we really look at the bigger picture, like you said, Dr. Sloan, this administration supported overturning Roe versus Wade, discarding more than 50 years of established precedent protecting women's reproductive autonomy. And now we're questioning oral contraceptives? Birth control has reduced unintended pregnancy. It has expanded educational attainment. It has increased women's workforce participation, and it's lowered maternal mortality through pregnancy spacing. And the FDA approved oral birth control in 1960. 1960, you guys. We are in 2026. So it reshaped women's economic mobility and health outcomes in the country. It's foundational public health. When you call prescribing birth control or birth control itself like candy, you're erasing decades of science. And if we're here to unpack everything said in this hearing, we may need to get to a longer AYA. But for now, let's just roll the next clip.
And some have been scared to vaccinate their children because they've been told incorrectly that vaccines cause autism. Do you believe that vaccines, whether individually or collectively, contribute to autism?
Senator Cassidy, you're a physician, I'm a physician. The reality is that we have an autism crisis that's increasing, and this is devastating to many families, and we do not know, as a medical community, what causes autism. The administration has just committed a huge amount of funding to look at the exposome of all environmental factors that could be contributing to autism. And until we have a clear understanding of why kids are developing this at higher rates, I think we should not leave any stones unturned.
There's been a lot of evidence showing that they're not implicated. Do you not accept that evidence?
I do accept that evidence. I also think that science is never settled.
I don't know what that motion was. You know, that sort of, what was that?
You know, Dr. Sloan.
That sigh right there.
Here's the sigh.
That's the sigh, because we as physicians are freaking pissed off that this woman is about to be the next Surgeon General of America. This is crazy. The Surgeon General of the United States, for those that don't understand, this is the nation's doctor. You know, this is who everyone looks up to. But they have some basic expectations, like, let's make sure you've completed medical school. Finishing residency would be ideal, which she has not. Maintaining an active medical license so you could actually write prescriptions and see patients, which she does neither. So Dr. Means, she may have finished medical school at Stanford. She did not complete her ear, nose, and throat residency, and she does not have a current degree or license that's active in Oregon. She does not see patients, but she's going to tell America what we should think when it comes to health. So you've treated maybe a pulmonary embolus, and maybe we've managed postpartum hemorrhaging. I don't believe she probably has, but counseling patients' families that are actually have risk factors, communicating with them effectively, and dealing with health, that's public health. That's not rhetoric. That's not anything. That's not theoretical. That is something that we should instill in a person that has been trained and meets the requirements, the recommendations. So hell yeah, we're pissed, And throughout this whole hearing, Dr. Means continually repeated this whole thing called shared decision-making. So let's define that. Shared decision-making happens when physicians and their patients, but she didn't have any patients. I'm being petty.
What? She doesn't have any patients, right?
No patients, no.
Doesn't have any patients. Okay.
To talk to patients. So, but after reviewing what peer-reviewed evidence, which she continues to counter at every turn, that she even has reviewed evidence, or she says, I do or I don't. So you're hem-hawing on basic information that the public is basing their health on. So no. So there is informed consent on vaccines, documented. There is informed consent on medications, informed consent on surgical procedures that she can't do because she never finished her surgical residency. So full stop. I'm a little heated. And we already do all of this, Dr. Brown and myself and every other doctor that is a practicing physician in America. But what we do not do is suggest that settled science is optional. So, should we give her another chance, Dr. Brown? I think not.
Yeah. Science and facts and peer-reviewed data, the CDC shows that 2 doses of the MMR vaccine are 97% effective to prevent measles. And since that measles vaccine was introduced way back in 1963, measles deaths in the United States have declined by 99%. Wait, what was that? It declined by 99%. In the influenza vaccine, it reduces pediatric ICU admissions and lowers mortality risk in children. That is not debate. That is not what we think. That is data. So the original 1998 study that suggests autism is linked to vaccines was retracted for a fraud. The author of that study lost his medical license. And remember that Dr. Means does not have an active medical license. So multiple large cohort studies involving hundreds and thousands of children show no causal association between vaccines and autism. And when you hedge on that, you don't just create nuance, right? You're creating confusion, and confusion costs lives. And let's be clear, she does not answer that directly. It's a yes or no question. Meanwhile, we have measles outbreaks. They're occurring in multiple states. 2 children died in Louisiana last year of whooping cough. Do you remember that video of an infant struggling to breathe with whooping cough? So as a woman of color, as a physician, as someone committed to public health, what we're witnessing really feels like institutional gaslighting. We're told that the science is uncertain. It is settled science, you guys. Settled science. We are told that proven interventions require, quote unquote, more inquiry. We are told that decades of evidence deserve hesitation. Meanwhile, Dr. Means has financial ties to supplement ventures. Some supplements actually contain these aluminum compounds that she seemed to be obsessed with. Yes, there is some aluminum in vaccines, and it's used in microgram quantities and has been studied extensively for safety. And the way that anti-vaxxers frame this is really alarming. Because we can't selectively fear science. We cannot weaponize doubt. And let me say this very clearly. There are areas where I agree with Dr. Means. Ultra-processed food is a problem. Metabolic disease is a crisis. Children's mental health matters. And the impact of social media on adolescent anxiety and depression is real. And many of us in medicine have been sounding the alarm for years. But credibility requires consistency. You cannot question FDA-regulated, extensively studied interventions like vaccines and oral contraceptives while getting money for supplements that don't undergo FDA approval. So that's actually federal law, guys. Understand that oral contraceptives and vaccines undergo rigorous clinical trials. And yes, if we are going to apply some scrutiny, that standard needs to be applied universally. It's not principled skepticism, it's selective doubt. And the Surgeon General has to communicate directly and defend evidence and protect the public, not equivocate and obscure and deflect. Because when clarity disappears, Black, brown, and poor communities pay first. Dr. Sloan.
I mean, this is not about personalities. It's not even about, us being peeved that this woman may get this position that she's so prepared for. This is about standards in America. This is because, being a physician is not casual. We didn't just haphazardly get this MD. Medical school was hard as hell. There's residency. You're talking, not 80-hour work weeks. Sometimes it is more than 80-hour work weeks. That may be what the law says, but there's been plenty of times I was in the hospital more than 80-hour work weeks. Missed birthdays, my own birthday, my kids' birthdays, holidays, worked plenty, never saw the Christmas tree. How about losing patience and not knowing how to carry that grief because you're not really taught how to do that? But we show up as physicians that are trained and finish. We carry on, and burnout is real. Exhaustion's real. But our commitment as physicians are also real because we finish our training, we finish our residency, we have active medical licenses, and we take responsibility for the independent care of patients that we do believe that we're helping. So if you're going to lead public health in the United States, I think you should at least respect the data, damn it. Finish your freaking training. Try to at least keep some credibility and keep your license active, especially if you're going to be considered, before a surgeon general. So if we speak plainly, science is where it's at. Birth control is not candy. Vaccines do save lives. Pregnancy carries risk, specifically for Black and brown women in America. But public health requires courage, tenacity, boldness. But it also requires leadership and truth. And Dr. Brown, Casey Means is not it.
No, we follow the science here at AYA. So stay empowered, stay disruptive, and remember that your voice matters. We are AYA, contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. And check out AYA.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.